As the majority of women are deficient in iodine, women's thyroid glands are about twice the size of a male's thyroid gland. And if you look at the amount of sufferers across the nation and across the world, you're going to see about 6 women to every 1 man suffering from thyroid disorder. And it's all due to the lack of iodine in the diet and the lack of iodine that's absorbed into the thyroid gland. The reason why women are deficient in iodine is because they produce high levels of estrogen, and they take in a lot of estrogen from milk products, soy products, and it works a little bit differently in women than it does in men. Even though these disruptors cause an iodine deficiency, the thyroid will start sucking in fluoride, chlorine, and block the ability for the thyroid gland to take in iodine. So if I was to take probably 5,000 women out there, close to like 4,900 of them would have an iodine deficiency. And what causes that, or some of the symptoms involved with that, are excess fat around the waist, cellulite around the thigh area, puffiness, low energy levels, hormone disruptions, mood swings, headaches, brain fog, the list goes on and on. But what really is the cause of suffering in women these days is fibrocystic breast disease. You know, when iodine deficiency was first looked at years ago, people were developing goiters. And a goiter is an extension of the thyroid gland on your neck, and it's when the thyroid gland starts to develop scar tissue or cysts on it. Now, what happens is because the ovaries actually produce thyroid hormones, and the ovaries absorb iodine just like the thyroid, as well as the breast tissue, that's why we're seeing a major increase in breast cancer, ovarian cancer, and fibrocystic breast disease, because it's showing the same thing that happens in the thyroid where the goiter is happening throughout the body. So once you put women on an iodine supplement, a good iodine supplement, there's a lot of different ones out there. There's potassium iodide, and there's iodine that are in alcohol-based tinctures, which can actually be toxic to the body. What we've done is created a form of iodine which is non-toxic to the body, and it's in its atomic form. When it's in the atomic form, the body doesn't have to break anything down, and it actually gets absorbed directly into the thyroid tissue. So that's what we're recommending women and children take. Another thing is, there's been a lot of problems with infertility, altered menstrual cycles in women, pain with menstrual cycles in women, and not only that, if a woman is deficient, let's say she gets pregnant. If she gets pregnant and her hormones increase, she's definitely going to have a deficiency in iodine, and that can cause spontaneous abortions. That can cause mental retardation in children. So it's extremely important for women, if they're pregnant, if they're nursing, or if they just have a child and they're breastfeeding, to be on extra iodine. It's really one of the most amazing supplements or minerals out there in the world, and yet it's the most deficient in women and men.
And I know for older women, they start to get mammograms, and of course that's going to really heavily radiate the breast tissue, which is terrible. Is this going to, will that help counter that effect, or?
Well, that's another good point. Personally, I recommend that women do not get mammograms, because 2 mammograms of the breast tissue is equivalent to about 100 CT scans, and that is just extremely damaging. And actually, studies have come out to prove that mammograms actually induce or cause cancer. But with the fibrocystic breast disease, think of how many women feel lumps in their breasts, and it's because of an iodine deficiency, and they run to the doctor and they get biopsies. And, you know, there are some false positive rates with biopsies, and who knows how many women, you know, went in because they felt a lump in their breast and then all of a sudden came out and, you know, had cancer, had a mastectomy or something like that, when we're not actually treating the problem. Right. You know, we're treating the cause